Hi, everybody. I'm so sorry about this being taking some time to come on live, technical difficulties, but welcome to see you all. So, let's start by just, hold on. Oh. Give me 1 second while I just get the post put on. Okay. Thank you for joining me, and apologies for the technical difficulty. It just suddenly looked like internet went off, but we're back. I know these are difficult times, a lot of uncertainty around over there. First of all, I hope everybody is well and healthy and feeling good. Thank you for coming here. On behalf of me as an expatriate, I would like to very much say thank you to the UAE leadership for the excellent work they're doing right now with COVID-19. I would like to thank all the frontliners, people who are working on fighting the COVID-19 problem, the health people, the people behind the scenes, the technical staff, the even people we take for granted, like the delivery people. Thank you so much for the excellent work that's happening over there. I think it's not an easy situation, but we have a lot of very interesting lessons to do. Now, as you just now saw, the topic that we're going to talk about is beyond COVID-19. And specifically, we're looking at agile government from a crisis management point of view, looking at responses and learnings. We have, as a university, several degrees, but more importantly, very recently in February, we had a conference on agile government. So this is a topic that we are very interested in. We have a lot of students actually working on the front line in health. We also have a specialization in health policy. So this combines both our interests together. So I'd like actually maybe first to start with why this topic personally is of interest to me. And there are two reasons. The first is I am interested in the topic from a practical point of view and also as a researcher. Now, from practice, it's kind of interesting that my first experience with the crisis was in 1998. And this was actually during an earthquake in Taiwan. Even before that, in 1993, I was through a bombing in India at the stock exchange in Mumbai. So when you think about the practical implications of a crisis, you get interested from a curiosity point of view. And I started researching it. My thesis actually was on the Asian flu, not like this flu currently, but the financial flu that was happening in the Southeast Asian countries. So I wanted to share a picture with you just to kind of highlight some of the points, but this is a picture of me and my family in Taiwan in 2003, and this was during the SARS epidemic. Now, 2003 is quite a long time. You'll see a lot of similarities right now with this picture and what's happening with the world right now. We're actually at the airport. So you start thinking, well, we did know a crisis was coming. There was the SARS epidemic. More recently, we had Ebola. We've been having these things around. Why was the world so unprepared? And I think that's some of the things that we'll be talking about currently right now. Now, I will briefly run through what is an agile government, and then I will take you through each angle of an agile government and relate it to the COVID crisis and some of the things governments are doing around the world. We'll end the discussion perhaps a little bit with what do we think will happen in the future? What are some lessons and learnings? And please feel free to send me questions. I'm reading them as they keep coming in, and I might take a couple of them and explain them along the way. Now, an agile government, and this is important, is like any government. I think the first thing we want a government to do is deliver public value. And an agile government has three areas. The first is future-proof policies. The second one we're looking at is a trust-based process. And the third, not the least, is wicked problems. So we'll go through each one of that. Now, what do I mean by future-proof policies? So we want policies actually in an agile government to take into consideration the uncertainty of the future. And we rarely see at this point in time, even though we did a lot of foresight activities, this hasn't happened. Why do you think that could be there? And I want to just give you a small example. What is future foresight like? So for example, do you know what's inside this ball? And the thing is, with future foresight exercises, you kind of know that something could be around in the horizon. You don't know exactly when it will happen. So it's interesting. The World Economic Forum has been looking at global risk for quite some time. And if you look over the last 10 years, they only identified among the top 10 pandemics once. And this was in 2015. So we clearly see that we can identify activities, but we don't know when it's going to happen and we're not prepared. So if you take an example, France, for example, had a pandemic unit, and they used to stock up enough minimum resources that were required if such a thing actually happened in France. That was masks and gloves and things like that. But because of budget cuts, the unit got merged with other units and they started getting rid of the stocks. So when the pandemic actually hit, they did not have enough stocks to actually manage that. And this is always the issue when you're doing future-proof policies. So there are three things we really need to look at. I would say future-proof policies require systems thinking. It requires alignment of goals. And most importantly, it requires teamwork, because policies are only good provided they can be implemented. So let's take the first one, systems thinking. And I think you've heard a lot about this word, systems thinking. So what do we mean really? So we understood that maybe there was a crisis in development stage late in December, 31st December. We got news out of China that there was a virus very similar to the SARS epidemic. January, we started seeing pictures coming out of China, and they were not good. And the lockdown in China happened somewhere towards the end of January. So we were warned as a world that maybe there was something that could go across borders. And this is where systems thinking comes in. You need to start thinking of what resources are required. So besides healthcare professionals, we needed things like ICU beds, we needed things like ventilators, we realize dialysis machines. So there was a lot more things we should have been prepared with besides gloves and masks. But clearly we didn't actually do that at all country levels. And just a simple example of this, for example, Italy, if you look at how many beds they had per 10,000 people, they only had 12.5 ICU beds. Remember, we're talking ICU beds. France had 9.7, and then compared with Japan that had 80. So you get an idea of how prepared countries are. And when you get a sort of signal that a crisis is going to happen, it's actually a sort of message for you to start going back and looking at what resources you have. And I think hats off here for a good example. You can look at UAE and the City Readiness Committee that was there in preparation for World Expo. So they were already looking at all the worst case scenarios and planning for that, and they were able to deploy their plan a little bit early. And today I think UAE has the second highest testing per density, which is pretty commendable. Now, it's not just systems thinking, right? We need to have a strong alignment on goals, because things like this, a crisis, very often you would have several levels. You'll have the federal level, and then you will have maybe state level, and then you'll have a much more local level. If you need to work in a crisis, everybody needs to be aligned on the same purpose. So what do you all want to do together? And this is a good example of how you're even looking at things like global citizenship behavior. So it doesn't help if you've got curfew, but half the people decide, oh, I need to go for a spring break, or I need to go on the beach, because the virus will still spread. So how do we do all of that? I think when you look at goals, the first thing is lives matter. And then you start looking at it at several levels. You could look at it first as national levels. So you could see, for example, Germany and some other countries immediately started repatriating their citizens back home. You could look at UAE and see the culture of tolerance, and you can see how they've extended the care even to the expats and residents who are outside of UAE. And then you can look at other countries, and you can look at some of the initiatives that they've done, for example, free medical care for even people who did not have insurance. This was implemented in UAE and even in places like Australia. Now, it's not just about lives, is it? because when you're thinking of things like physical distancing and you're thinking about jobs lost, and today that will be one of the biggest challenges which we have, which is unemployment. So let's talk about livelihoods, because that's another thing that you want with purpose. What do we do with people who have lost their jobs, with small businesses who can't keep afloat if it means a choice of keeping an employee, and all those millions and millions of people in the gig economy? So unemployment obviously becomes part of the strong purpose, and you see that. Now, you can see some of the messages that go about, for example, let's say in Singapore, where they talk about we're all in this together. So it's about a community spirit, and it's about every individual doing their bit. You can see this even here in UAE, where everybody, irrespective of whether they're nationals or they're expatriates, all want to work towards to getting rid of the COVID virus spreading. It's not enough just about that. You're looking at things like industry support. Now, there are some industries which are hit much, much higher than the others. For example, we've got industries like logistics or hospitality. And how creative can you be when you're managing this? So how agile can you be? So New York City actually cut out a deal with the hotels to actually convert them into maybe recuperation centers for COVID patients. In Australia, they realized a lot of private hospitals were going out of business. So what they did was they brought them into the public hospital care system. So that way, even people there could keep their jobs and they could contribute. Another important message is you probably don't want to leave anybody behind, because governments are about inclusiveness, and this means the elderly. So, for example, not all countries have a culture which is very family oriented, where we take care of our old. So in those cultures where the elderly are by themselves, or you might have people who are physically people of determination, or you might just have people who are marginalized, very poor, not being looked after, or maybe even single people. How do you manage them? And Belgium, for example, had an older person's council, and they actually used that to call everybody to ensure that they were taken care of. In places like Canada and San Francisco, they've been trying to look after homeless. So this is also very important when you design policies. But again, like we said, policies are only good as in implementation, and these are at multiple levels. So at an international level, I think this is where we've had the biggest challenges with COVID-19. Currently, right now, there are 210 countries with COVID-19, and that means that the challenges are, if we all don't lock down at the same time, the virus will spread. So for example, Singapore is in its third wave. And most of the people who have come in back with COVID positive have come in from USA, UK, or Indonesia. In Australia, it was the cruise ships. And in China, currently right now, they're getting COVID cases again with people returning back to China. So this crisis will keep continuing unless we all lock down at the same time and we manage it. If we have different lockdown times, I think it won't actually solve very easily. So an interesting experiment currently that's being held is actually India, which is trying a 5-week lockdown currently. And that is interesting because India is one of the world's largest populations currently right now. Now, we also want to look at things like teamwork. For example, when we're looking at COVID-19, it's also about how we share data, because if we want to solve this, we need everybody's minds to work on that. So Tokyo, for example, created an open data website so people could look at it and try and figure out how they could go and manage it. So how are we working together as a team? And it's not just at a national level, but at a global level to make sure this is getting done. So as we think that many countries are working towards solving problems at a national level, and many of them have done exceptional jobs, we still have a lot of work to work as a world together solving as this problem. And I hope in the future the World Government Summit will actually be the one and the place that will go and discuss this. So just a quick recap, future-proof policies require us to look forward. And this is extremely important, especially as we know next year will be a difficult year financially and also from an export point of view. So we need systems thinking, we need alignment of goals, and we need teamwork. Now, the next part for an agile government is trust-based systems. So what do I mean by a trust-based system? Many governments have been proactive. We are now moving into online meetings. We're working at home. We have online education. I mean, hats off to parents who've become teachers overnight, and they're managing not only their jobs, but their children and managing their schedules. We're also looking at fast-tracking vaccines or health solutions to make sure that we can manage COVID in a better way. But there are issues which we can see when we fast track things. For example, we recently saw with Zoom, there were privacy issues, or we don't necessarily have health sandboxes in most countries. I think only 5 countries before COVID came in actually had policies for health sandboxing. So one of the challenges with trust-based processes is to create a system of transparency and to ensure communication and a culture of values. So how can we do things like transparency? So one is actually data sharing. In Singapore, they worked with the app which was traced together. That meant you could see anybody who was COVID positive and all the people that they had actually gone and met. And this was interesting, but obviously with the European Union and their laws on data privacy, they weren't very happy with this, and they're trying to work on a solution where you can safeguard the identity of the person. New Zealand has been working on, again, accountability, so you could still do complaints during COVID, whereas a lot of countries would say we're going to push that aside on one side. So these are interesting examples. In terms of communication, obviously during a crisis, especially like this, what's the first response from a lot of people is fear. I mean, I'm scared, I don't know what to do, and that's the response people have. So what do governments need to do? They have to give the perception and communication. They understand what's going on and they have it under control. And this is really difficult, especially in today's age of social media, because rumors fly around so quickly. So again, just for example, besides penalties that can be there, Singapore also has a website where they debunk rumors. So they will put up rumors and say, well, this was there, this is false, here's the truth on the situation. So you need to manage crises very proactively by communicating that you have in control. You need to communicate timely. It's very, very important you have the messages on time. Give people a little bit of warning. So when the lockdown came in India, the first lockdown, I think people had less than 4 hours to actually move. And what happened was, unfortunately, a huge migration of workers who were earning on daily wages. So this created very much a lot of challenges for the cities who were suddenly having a lot of these migrant workers. You also want to look at a culture of values. So what do we mean by a culture of values? A culture of values, we could go back to the UN principles of human rights, and there are people who are left behind. So for example, refugees. There have been people left back behind between borders as borders closed down. So I think this becomes interesting in terms of solidarity between countries and how do we manage that. And again, hats off to the UAE for the amount of aid that they are sending to other countries nearby to help them manage their systems. Another example of cultures of value is perhaps Ireland. Ireland gave a call for all their retired healthcare workers and asked them, would you like to come back and help us work? And it was interesting, within 3 days, they got 24,000 applications. So we have a lot of untapped resources currently right now, and I think it's really important to tap into those resources. On the flip side, which I found was interesting, was USA and UK actually tried to fast forward their graduation of medical students and get them to join the workforce. Now, keep in mind, this particular crisis is very traumatic for mental health because the things that you see in the hospitals may not be exactly something that someone who has no experience is actually ready to face. So I think, again, culture of values is how do we create a community support system for each other and get through this together, and that's important. So creating a trust-based process requires transparency, good communication, and a culture of values. And now let's look at the last point of an agile government, and that's a wicked problem. Now, in managing wicked problems, one is managing perceptions, one is managing spillovers, and surprisingly, it comes back to foresight. So let's look at managing perceptions. At the beginning of this crisis, we had a lot of mixed messages. Wear a mask, don't wear masks. And I think it came from many different entities. And we find that we're not really sure what to do. Now, what we do know is the virus was evolving. And as time went by, we're getting more and more information. So managing perceptions of what we know and what we don't know, of what is the truth, is very, very important. And again, I think always it's important that we show that we are acting and we're busy. So how the governments actually do this is by communicating information, by having regular sessions. So in some countries there are daily briefings, there is news reports, and this helps people understand what can be done and what cannot be done. Now, when we look at spillovers, I think the important thing with this is realizing what started off as a health issue has spilled over into things like economy, into the business sphere, into areas like social welfare. So we are having multiple crises at the same time. And how do we manage that? And this becomes important for the long term, because I read one report that says maybe US will take 2 to 3 years to recover, for example, economically. Trade, they all expect will be down this financial year, and next year, surprisingly, it will be the developing countries who will rebound much faster than the advanced countries. So this makes us rethink what the world will look like at that point in time. And I think the important thing with this is to understand there's a lot of opportunities beyond COVID-19. So the first one is I think there will be a reorganization of world power. Clearly, the world is moving towards the east. We already saw a couple of reports with that, but I think it will happen at a much, much faster pace. I think governments will have to rethink some of the things we took for granted, things like universal basic income. What is education? Because clearly something like citizenship and global citizenship behaviors might need to be taught at a much earlier stage in schools. Things like online education and online work, we might have to rethink what is the impact of that on socialization. And we are human beings, so we are not naturally social animals. How would we manage that better? So looking at all of these things, I think we have ample opportunities when we look at how we fight with crisis. I mean, I just referred to COVID, but there are many, many other countries and many other crisis examples that we could go back and look at and see how countries went and adapted to that. And I'm happy to take some of your questions right now. So if you have questions for me, that would be great. So I think most of you find this as an interesting topic. And like I said, I've been researching it for some time. I found it always interesting to think of crisis as opportunities rather than an issue that we sit. By the way, this is very important to mention. It's always easy in hindsight to go back and look at a crisis and say what went wrong. It's very hard when you're in a crisis to look ahead, just very much like that picture that I went and showed. Because I think when a crisis actually happens, you're hit on so many fronts, you don't know which one to focus on. I see some questions have come in, so I'm going to actually look at them. Give me a minute while it loads. So there's a question that says, as we lock down and attempt to work from home while wrangling children, managing grocery logistics, checking in on family and friends, caring for our own mental health. So here's somebody who's saying that they're finding it quite difficult, and I agree, it is challenging. We've never been in this situation before as a world, where we are isolated, but we're still together. Everyone is facing a similar kind of isolation. And all I can say is thank goodness we do have tools that we can talk and share with. A lot really comes back to community, and I think this is the time we need to go and not feel ashamed to reach out and ask for help. This is the first thing. I think we've always thought of asking for help as a weakness as societies, and I don't think there's anything wrong in asking for help. I actually struggled at the beginning of this because the internet went down and I had to call my daughter to come and help me with Instagram. This is the first time I'm doing this live. And that's okay. I think we're all learning. It's something new. We didn't have a rule book for this, so it's fine. Someone else is talking about so they're talking about people who have, by the way, people who have waived the keynotes and some activities that are happening. I need to bring this up. Very recently, the government of Estonia launched the global hack. And what was interesting about this is they had more than 12,000 people from over 100 countries join in, and they're over like 3 or 4 days, all they did together, everybody free, mentors free, was just work on solutions for COVID. So we can see currently right now, and I think this is the amazing thing, is there's a lot of creativity flowing. If you look on Twitter, if you look on Instagram, if you look on Facebook and YouTube, people are posting amazing things of how they're occupying their time. So I think it's a great opportunity for innovation. I have a student himself who called Syed, who's in my Masters of Innovation program, who's designed a machine for helping in sterilization that's currently being bought by, I think, the Sharjah municipality and the Dubai port. So I think this is interesting. Someone's asking whether they think a complete lockdown is useful or not useful. And again, I think we don't have answers for that. We knew so little about the virus in the early stages. All we had was what we knew about SARS and MERS, and most of those were contained to certain areas and they died or disappeared and they could be managed. So we never had these kind of cases. So one of the things is we need to be patient, and I think at this point, if we're not all in it together, it won't work. So it's really about us all being in it together, and we have to trust our leadership on this. Another question was, do we think we need to focus on how do we prepare our medical people and the internal stocks of equipment? And this is an interesting question. So what do I see happening? Already I heard from Germany that they will be relooking where their factories are based and maybe bringing back some critical manufacturing into their own country. I think at the end of this, a lot of governments will go back and take a stock on what do they think are critical and what are the minimum number of supplies they require. So we will relook the global supply chain. I definitely think that will happen. All right, so here's the other question. Do you think we need more efforts in health research centers? Research. So there's a lot of research that's currently happening. If you see the amount of papers being posted, and I think there's two types of people. Some people are just posting what they're finding without charges, so they're giving up their IP, and this actually happened in Germany. There was a small manufacturer in Germany. In December, when he heard about the virus, he started creating test kits, and he actually put up the design for the testing kits very early to contribute back to ensure that people had some method of testing. In other cases with a lot of researchers, they're first publishing their research and then giving the data, and this creates a little bit of a time delay. Now, this is part of the system where we wish the research is published and you get actually priority for where you publish. So it probably will have us at the end of this entire activity relook some of those things that we thought were the right best practices and how we should actually do that. All right, so one last question. Is there a national program dedicated to mental health? So if you are following the well-being, I think the Minister for Well-being has launched a channel currently right now on Instagram where you can go and follow it, and they do have discussions with experts on mental health. Worldwide, I think mental health is still very much sometimes a taboo topic for many, many cultural reasons. and we still need to go a long ways in that area. I think we still give priority to physical health rather than mental health, though they are related. And again, perhaps some of this will start at schools, where we actually create happier, more resilient people. And if they're more resilient and they focus on well-being, I think it would be a much more healthier and safer place. So I hope I've answered all your questions. I'm not sure if there are any more questions, but thank you so much for joining me. It was a pleasure. I apologize again on the delay, but hey, this is what it is, right? And stay safe. Please join us again in 2 more days for the next talk. We have some very, very exciting talks from my colleagues at the Mohammed bin Rashid School of Government. And thank you so much to the leadership at the Mohammed bin Rashid School of Government, His Excellency Dr. Ali, and our Dean, Professor Raya Dawamde, for all the things that they have done and for encouraging this. See you later. Bye.